According to a recent study, oropharyngeal cancer is roughly 9 times more likely to develop in those who have several oral sexual partners. Dr. Mehanna of the University of Birmingham issued a warning that the rise in cases could be seen as an epidemic. Throat cancer has increased rapidly in the West over the past 2 decades, to the point that some have called it an epidemic, Dr. Mehanna wrote in the conversation. Oropharyngeal carcinoma, a particular sort of throat cancer, has seen a sharp increase recently, which is the cause of this. The number of sexual partners had over a person's lifetime, particularly oral sex, is the greatest risk factor for oropharyngeal cancer, according to Dr. Mehanna. Oropharyngeal cancer is 8.5 times more likely to occur in people who have had 6 or more oral sex partners over the course of their lifetime than in people who have not. The human papillomavirus, HPV, has been linked to the upsurge in oropharyngeal cancer cases. According to Dr. Mehanna, 80% of adults in the UK have admitted to engaging in oral sex at some point in their lives. The most common signs and symptoms of the illness are listed by Macmillan Cancer Support. Oropharyngeal carcinoma symptoms can include a painless neck tumor or edema, a painful tongue or throat, earache, swallowing or jaw and mouth movement challenges, voice alterations, bad breath, unaccounted for weight loss, tonsils that appear uneven. All these symptoms can be brought on by other conditions, the organization claims. However, it's crucial to have your doctor examine them. Early detection is key to successful treatment of oropharyngeal cancer. Oropharyngeal cancers linked to HPV frequently start in the tonsils or the base of the tongue, continued Macmillan. According to Mount Sinai, a network of hospitals in New York, HPV-16 is the primary cause of oropharyngeal cancer in those with HPV. Describe HPV. According to Mount Sinai, there are more than 100 different varieties of small-sized DNA viruses. According to the Centers for Disease Control and Prevention, CDC, cancer typically develops a year after HPV infection. How to lower your risk of developing oropharyngeal cancer if you have HPV. The CDC notes that condoms and dental dams can lower the chance that HPV is transmitted from one person to another when used consistently and correctly. Smoking and drinking may contribute to the growth of the malignancy.